And our tagline is, do well, invest in Floel. So what's the problem? Leakage. It's called urinary incontinence. We treat a special kind, which is the most common, called stress incontinence, not psychological stress, which is there, but the mechanical stress of a sneeze, cough, or laugh, raising pressure in the abdomen, squeezing on the bladder, pushing urine out, and the urethra normally resists that, but if there's some damage, then it can't resist and she leaks. And it affects roughly 1 every 4 women worldwide. What's the solution? Block the leak. Instead of absorbing the leak after it comes out of the body and having smelly incontinence pads, we have a device that the doctor inserts in her urethra in the office, no surgery. On the lower left, you can see the urine passage. And when the woman sneezes, coughs, or laughs, the pressure on her urethra closes the device and closes the urine passage and blocks the leak. Because we want to change it out, we don't want any surgery. And so there's a bulge at one end called the retention feature. The device has an antimicrobial, and so it has to be replaced 3 times a year for life. And that provides a lot of revenue to the physician. It also saves the woman 120 hours a year of changing diapers. So the patient demand is high. We interviewed 80 incontinent women, 77 said they'd adopt our device. Physician demand is driven by money. There are existing reimbursement codes for physicians. Every time they swap out the device, they earn $500 to $2,000 per patient. And so the typical practice can increase their revenue by $500,000 to $1 million of new revenue per year, which is about 3 to 5 times what the gynecologist earns in salary. Strong motivation. And we got the right team to solve the problem. I'm a biomedical engineer. I'm a co-founder, co-inventor, and I act as the chief medical officer. And I've been working with incontinent women for 20 years with a previous company. I know what they go through. They tell me. And it's terrible. So I developed a deep empathy for them. And when Sherry came along with an idea for a device, we started working together and eventually produced this device.